mine first.
Husbands are not bad, unfortunately. Hey, this will be your one chance. You'll put a hand there. He can handle it.
Nice jacket you got on
Yes,
there.
you do.
He's saying I'm not.
Oh,
Recording in progress.
If you're online, if you wouldn't mind signing me into the chat box, please. Thank you.
Now, welcome everybody to the Franklin County Prevention Coalition and Franklin County Health Council meeting. If you don't know me, my name is Jessica May. I'm the Health Council, one of the Health Council chairs. Tabitha's not here today, so if you will check your packets, you will have, if you haven't already, you have a set of minutes. We'll do that first. Go ahead and look those over, make sure they're okay.
Can I address on the veterans? We do have a Veterans Affairs office in the old vacational wing.
Photogenic people.
I know, right?
I look like a gargoyle when I try.
Okay, hold on just a second. Got 'em. I didn't hear Is that in the minutes?
They're talking about lack of veteran resources, and they're
Gotcha.
actually a great resource and can help in many areas.
All righty. So how do we let the record
We need
reflect that?
to, we can change it.
We make a motion to amend.
We want to say lack of awareness of veterans resources.
Okay,
They're there, but people not, whoever mentioned that just wasn't aware.
all right. Somebody want to make a motion to amend the minutes?
I'll make a motion.
Somebody want a second? All right, all in favor? Say aye. Y'all gonna have to wake up. Any opposed? All right. So I guess we'll go around the table and do introductions. I'm not sure. I think there's a few people that I don't recognize. So Melanie, go ahead and start.
I just got our mouthful of food. I'm Melanie Morrow. I work for the Franklin County Prevention Coalition.
I'm Alana Morrow. I also work for the Franklin County Prevention Coalition.
I'm Sophia Leon Mesa. I'm public health educator for Franklin Grundy and health council facilitator.
Beth Delaney, Health Promotion Director for Southeast Region.
Sue Fulmer, Blessings in Kiwanis. Kathy Fulmer with the county chamber. Sharon Bott, administrator, county.
Jessica Rackley, Community Health Resident Partners for Healing.
Christy Shaw, as educator with Decision Table.
The county magazine, just hit the street. Oh,
Yay!
You were complimented on that this morning. Right. I'm excited about it. It's gonna be good for the community. Let me find out. My sales manager took off to Pennsylvania, and so we just had a few copies to get to our advertisers. So we'll see if we can't load Miss Lisa and Jesse. Melanie,
Jessie
we've already
been
asked
there?
them more for people. But there is, you can read it online if you go to goodnewsmag.com. There's a digital flip version. Yes, ma'am.
Kathy's in there.
Yeah, I hung that up in the library. She didn't like that.
I'm Lisa Wallace, I'm with Dance Pharmacy. I'm Cindy Smith, I work for the Franklin County Prevention Coalition. No, I'm sorry, I work for the county. I'm trying to help Vicky.
It's Monday.
Yes, that's it.
Barbara, King Lad, I work for Family Resource Center.
You had to point to him.
Well, you know, that's my boss over there.
It's another thing what I said, right?
Matt Brown, Regional Overdose Prevention Specialist, Region 5 South. We're based here in Franklin County Prevention Coalition.
I'm Dustin Owens with SOCAP.
I'm Dustin Ritchie, the other Regional Overdose Prevention Specialist.
I'm Rowan Wiley, I'm the AmeriCorps Vista here at Franklin County Prevention Coalition.
Mr. Rubin?
I'm Ruben, I work for the Franklin County Prevention Coalition.
You can just give me. I'm Paula Rhodes, I'm the bridge coordinator for the Prevention Coalition.
And I'm Jessica Head, treasurer of the Franklin County Prevention Coalition.
Miss Pat, would you like to introduce yourself?
Pat Bradenstein, I used to be with the reentry program, retired recently, and have a ministry called Wings of Hope, Widows Ministry, and then doing a few other little side things.
Side hustle.
Right now.
She's a side hustler.
And also, we have a dude from Centerstone, I got her up here, so.
Awesome.
I'm Breezy Hayes. I'm the substance abuse program manager with Centerstone.
All right, well, welcome, everybody. Okay, so we are gonna work on the county health assessment with Ms. Sophie.
Yes. Okay, so for those of you who have been to our last couple of meetings, we started working on our county health assessment for Franklin County. And I wanted to give you guys an update. I have a short presentation. And this will kind of let us know how we're doing with our survey that we've been trying to get out to the public, okay?
I failed to have the people online introduce themselves.
Right.
Okay, all right, so far, we've done what, this a month now? So far, we have 237 surveys completed. We have done one listening session and we don't have any key informant interviews completed yet. All right, so people who have taken our survey, this is the minimum age, they have been 17 years old. The maximum has been 87 years old, and the median age is 49 years old. Okay, and then gender, 81% and 81.4% of the people that have taken our survey are women. 18.1 are males, and then 0.4% prefer not to answer. On the right-hand side, you'll see this chart. This is their level of education. This first one is less than high school diploma. I actually have I don't know why it's not showing on here, but I actually have the exact numbers for how many people that are at the education level and little area right here. So the first one is less than high school diploma, high school and GED will be this one right here. Vocational training certificate, associate's degree, bachelor's degree, graduate degree or higher, and then prefer not to answer. Okay, and then race or ethnicity. 1.3% of people that have taken our survey are American Indian or Alaska Native. We don't have any Asian or Pacific Islander. 6.4% are Black or African American. 2.1% are Hispanic or Latino. 89.8% are white. And then our other category is 0.4, and then 2.1% prefer not to answer that. All right, and then this is again people who have taken our survey. There was a question on there about your income. So this blue right here is the ones who make 25 to 50,000, and that's about 24.8 of the people that took our survey. 17.9% are between the range of 50 to 75,000 a year. 20.1% are 75,000 to less than 100,000. And then up here in the purple, we have 21.8% who make 100,000 or more. This little purple one is the ones who prefer not to answer that question. And then 12.8% less than 25,000.
Sorry.
That's okay, okay. All right, so on our survey, you guys know there's all those 12 vital signs, and it has you list them, whether it's not a problem, minor problem, or a major problem. So everything in the blue is not a problem. Everything in the orange is a minor problem. And then everything in the gray is a major problem. And I'm gonna go over these just so you can get a better understanding of them. So this first one says youth obesity. The second one says physical activity. Youth nicotine use is the third one. And then it's drug overdose, infant mortality, teen births, community water fluoridation, frequent mental distress, third grade reading level, preventable hospitalizations would be this one right here. Personal income is this right here. Access to parks and greenways. Adult smoking. Adult obesity. Neonatal abstinence syndrome. Suicide. Educational attainment. Diabetes. This one is immunizations. ACEs. Heart disease, cancer, and uninsured rate. From what I can see, that the ones who took the survey, drug overdose is pretty big. They listed as a major problem. Which one was, adult obesity is another big one. Adult smoking. Youth nicotine use was pretty big too. And then there was another category. I need to go back and tally those. There was just a lot of those. But I'll go back, and whenever we close up the survey, I plan on doing the updating these numbers right here and then updating the other category. Because there's another list of things where people could add more things, and you'll see it. I just listed them on there. I didn't do the charts for those, but yeah, for this chart, for the 12 vital signs, those are the top categories so far that people think it's a major problem in our community. Let's see, I think, yeah, and then cancer was another big one as well.
Get the arrow button. It's right here, is you see that, the down arrow.
Oh, I'm over there. Sorry, Miss Kathy's having trouble finding us. Keep coming in. We need another chat it out. All right, I got you. You choose the page.
All right, so here is the other major problems. For this, I would include a chart with whenever we post up the survey. But some of these were pretty interesting. And then some we already kind of knew from our meetings. So meeting space for educational classes, affordable healthcare, affordable housing, mental health access, lack of facilities for uninsured, drug use and selling, unemployment, homeless assistance, no homeless shelter, indoctrination, bullying, racism / discrimination. So I try to combine some of these because they were kind of the same. Wildlife preservation, child abuse and neglect, human trafficking, lack of healthcare workers, need more youth programs, vaping, youth substance abuse, internet access, single parent income, parenting birth to 4 years of age, transportation, which you know that's a big issue, lack of kids and youth entertainment, lack of affordable fitness opportunities, food cost, and lack of organic fresh foods. lack of positive after-school activities for students, reading levels, poor driving skills, I thought that was more students. Environmental protection, language barriers, divorce rates, welfare, abuse, and sexual assault, and then veteran resources. So that's some of the items that were listed in the other category. So I thought, let me put those on there so they can see them. All right, if you'll go to the next one. Okay, so what now? So that's where we are at with the survey, and that's what some of the response has been. If you guys have any, do you guys have any ideas how we can get this survey out to the people that we are not reaching?
I was saying, one of the things I noticed when you went through the demographics is the demographics of the people taking the survey do not represent the demographics of Franklin County. So we have, we have to get 2 more people. Did, the Bonners get out this weekend?
They were setting up at Walmart on Saturday.
Okay, did we heard how that went or gotten the survey?
I have not.
Okay, so one of the things that we did is reached out to the University of the South. The coalition has a Bonner that has been working with us, and they just volunteer their time about 5 to 6 hours a week, and she's been doing some prevention work up there on campus. And so we reached out to them and said, hey, we have this need of getting the survey out. And so they got together and had just a volunteer day and scheduled for people to come sit outside Walmart. So I'd like to know, we haven't heard back how many surveys, because that was just this past Saturday. So that's one way we're trying to get out, and because we need more hands, especially, to sit out all day. So that was amazing. And I think they plan on doing it another time or two.
Yes, so, special, if y'all see Kit Common, please thank him, because he has been so easy to work with. He did not make us go through the corporation, main office, so he has been so easy and very helpful throughout this process. But yes, he just said, Sophia, let me know what dates, and we will make it happen.
That's
So
awesome.
if anybody has anything coming up, any events, or you feel like you have time to set up, even if it's 2 or 3 hours, and we can work something out with the Bonners and Canales, or where we can do shifts, let us know. Because so far we have 237 responses. So the more that we get, the better, because it will help us kind of focus on, okay, this is what the community thinks we should be working for the next 3 years, or find the areas of improvement for Franklin County.
And we need to make sure that every aspect of the community is being represented fairly. So, if only, 16% of those making under 25,000 took the survey, that's not a good representation for that group. So, we need to take a look at that demographics, and we need to target the demographics that are lower than what our county census says it is. That's how we just maintain being culturally competent with what we're doing.
Ms. Kathy?
Have you given them out to the Almost Home and Good Samaritan and places like that? That actually
No,
deal
that's
with
an
that
excellent
demographic?
idea.
What if you had, I don't know about the community one day, but you did this survey?
Yes, so that was another thing I wanted to touch on. I know at our last meeting, we decided to post up the survey on May 7th. And they actually, because one day was set for May 7th. However, they moved it to May 14th. So would you guys, I know it's pushing it, because our meeting is our May meeting is May 16th, which is that Monday. So if we extended the survey one more week to that Saturday, we could come and set up a table and just do surveys there.
Some of your counties are extending and just deciding they're gonna take longer to get
Good.
data. If that's something you wanna do.
Good.
Well, so far, they're at the library. We
Yes.
set up at the Business Expo.
Mhm.
And then we set up at Walmart.
Walmart.
We have them out at Journey Food Giveaway.
Reentry
So reentry
and
is
the
taken care
Women,
of.
Wings of Hope.
I can set them up at businesses, doctor's offices, churches, about putting on the home and school kids?
No, I did send it to the schools, and they sent it to the staff, but I don't think they shared the link to the parents. I don't think they've done that yet. Have you heard on the all call? No, they haven't.
What about like the low income housing, we're trying to get that through? What if like this water scholars that are working with us, could they like, canvass the neighborhoods of like the low income apartments?
I think that was one of the ideas. I think she was working on getting volunteers, because they are doing, I think this is their final week. Or the last 2 weeks, because they leave the beginning of May. So that's where she's having trouble getting volunteers. But yeah, I mean, we are trying to do our best to distribute it everywhere.
Have you done anything with local mental health agencies?
I took some to.
No,
They're-
they're you.
Okay. So,
Town and Hog has a stake off the 14th if anybody wants to set up. I know Dustin and Matt are, I think.
okay.
There'll be vendors and
Will
stuff down
you
there.
be there?
Yeah, we'll.
Can we send some surveys?
Yeah, we'll
to
put
you
surveys
guys?
out on there. Anytime we do anything in Franklin County, now we always put surveys.
Okay, awesome.
And if you hand someone a paper survey, they can always return it to the library.
Yes. And also let me know, if you have some surveys ready for me to pick up, I don't mind. And I can, put that on my schedule for the day.
And if everyone could share the link on their Facebook, on their social media, we have it posted, I think Pop Council's posted it, it's going on with WCBT.
We're in works with the Herald
Yeah.
right now,
Get
get it
that.
out there. Yes, and then we're working on, Everywhere Direct Mail. She had that awesome idea. So we're working on that as, and then I'm planning on doing, like Sherwood area, Belvedere, Huntsland. I think our mini grant, I budgeted about $600 for that.
We actually did send out the link on all the Huntland water bills.
Okay,
They let us put them on all the back of the water bills.
good.
What about the voting precincts? Will they let the,
Oh,
Haven't
that's
thought about
good.
that.
will they let, you'll have to ask Margaret, I don't know if she'll let.
Well, if we can't do paper surveys there, we could maybe put up a poster with a QR code.
Mhm.
We can get those printed today.
Okay, good idea. Thank you, Miss Kathy.
If we come up with posters, would you businesses hang them up in your businesses? Okay.
And I know the mayor's office has also been sharing.
Yeah, they sent it to their government employees too.
Good. Yeah, well, I just wanted to give you guys a little update on how we're doing with this and who's taken the survey and the kind of responses that we've gotten. So if you, I'll be here after the meeting, just come talk to me if you have any other ideas, or if you want surveys to take with you, let us know.
Okay, are they in Spanish as well?
Yes, I have the link and the QR code in Spanish as well.
Those the, Spanish speaking, the one that, gets volunteers for the Spanish speaking, runners for one day. She could, help a lot
Help with
that.
those. Okay, yeah. Okay.
Can you send me that or have you already?
Yes, I can send that.
No, you have.
Okay. All right, so that is my update for this. Y'all just come talk to me if you have any other questions.
If anybody in here hasn't taken the survey, we will,
I think there's some hard copies too.
and there's a couple hard copies. I can
Yes.
print some more if you'd like to take a second and take it. That would be
Yes.
great.
All right, well, thank you. Thank you, guys.
All right, does anybody have any questions for Sophie? Okay. All right, program updates, Franklin County Prevention Coalition.
So I have been, I don't want to say in a soapbox, because I kind of live on that. But there's a problem it's not just a Franklin County problem, but this is what, we can affect. We know that vaping in schools is a problem, we know, youth vaping, but then that got me thinking about the vapes themselves. Right now, the big vape that's super popular is they're marketed as a disposable vape. You get them, puff on them, they run out of battery, they run out of juice, whichever one runs out first. And then you're supposed to what? Discard them, right? We don't have a safe way of doing that. So nicotine is classified, because I was doing some research on this, because, when schools had to take them up, they had, they're collecting them, and, we need a safe way of handling, storing, and disposing of disposable vapes. And so I was doing some research, and I found out that nicotine is an acute hazardous waste. And what's in these vapes is liquid nicotine. So if we throw that away, let's just follow that process, it goes into the landfill, it leaks into our ground, and it goes into the ground, it gets into our water system. No, thank you. We can't put them in with the drug disposal boxes because they have batteries in them. The batteries, we can't just throw a battery into the trash can either, but you have to be careful disposing of batteries, because if they connect together, if they scrape against something, if they get put into water, batteries can explode and cause fires. So we can't store them together. We can't put them in with the drug disposal boxes, and you're not supposed to throw them away. So retailers are selling and marketing a product called disposable, and that we cannot safely put into the trash can, and yet there is no safe way of disposing these. There is no program. I have been talking to people across the state, and I've been looking online again, for other states if they have something. And this is a problem that no one seems to have identified, and there isn't a solution. But I have a major problem with putting an acute hazardous waste and more batteries into our water table. But I need more people vocalizing that and helping me come up with some solutions. Because right now there just isn't. I was talking to Ricky at WCBT, and he talked to his friend, who's it, Bill? At Waste Management. And he said that, well, what you can do is bring them there, tell them what you're trying to dispose of, and they'll guide you or keep it until the household hazardous waste, we do that like once a year, and bring it to that. I don't see that as a good solution. We can't hang on to these things for a year. So I don't know. Anyone have ideas, suggestions, thoughts on that?
I was going to suggest solid waste, because we have some items that have lithium batteries, and solid waste has agreed to take our lithium battery items from the health department.
And that's what Bill told Ricky, is you can bring it up to them. The people that are using these are not going to do that. My thought is,
maybe we could have collection sites, and then we gather them from the collection sites and then take them to solid waste.
that was a thought process that we were going through. The concern with that is, if, let's say, you've got a lockable container that you just throw these in, but then you've got these batteries all together, and if someone were to put a water bottle in there, that can create a bad situation, is how it was explained to me. So you would have to take one each in like an individual sealed bag and put it in there, and then that would be okay. But again, that I'm not sure that's good for just open to public use, because I don't know that people would follow that.
Also, just FYI, the youth are not throwing them away. They figured out a way to recharge them using their USB on their computers.
Yeah, so that's another common problem that parents need to be aware of, is they are taking these vapes apart. So they're taking this hazardous waste, this acute hazardous waste substance that is extremely addictive, that can soak into your pores, particularly if you have a cut on your hand, and they're taking these devices apart. And the sponges that are in there that have the nicotine in them. And then there is this battery that has died. So typically there is still juice left in the sponge. And they take the battery and they take typically like a cell phone charger, and they take the end off, and they have these 2 wires, and they connect the wires to the wires on the battery, and then plug it in and recharge these batteries. Again, can lead to an explosion or fire. It's very hazardous. Once you recharge those batteries, they become unstable and they can explode in your pocket or during use. But that is what our youth today have come up with. I wouldn't mind if I had people helping me write some letters, educating some lawmakers about what's going on, because essentially we just created a dangerous product that we have no way of controlling or disposing.
It might be something good that for the Prevention Coalition to write a letter and have all the groups that agree, you know, to maybe make that a product you can't sell in Tennessee.
I can educate, I cannot lobby.
Oh, you can't lobby. Okay.
I can educate. Now, my volunteers, on the other hand, you guys are free. But I that's a conversation that needs to be had, just in general conversation with other people. And that's where, you know, you can really be effective with the coalition, is just having these conversations. They're like, hey, what do you do with that? You know, did you know that that's not a safe way of disposing that when you're done with it? You know, letting parents know, hey, recharging those things is something kids are doing. You might want to keep an eye out for it, you know, and just spreading the word and starting to educate people. And the more people that are aware that this is a problem, then that's more people working on a solution. You know, from what I understand, like even hazardous waste is kind of like, you know, it's new. It's new. It takes time for these things to come up. And if we're going to sell them in stores, I think there needs to be a safe way to dispose of them in stores where you get them, or, you know, somewhere other than, you know, having to take them to hazardous waste.
Could you find an environmental group that can lobby and maybe educate them? I mean,
I'm working on it. I'm working on it.
that might be helpful.
Other than that, we have our update in our newsletter. Everyone should have a copy. Is it uploaded on the website? So you go to fcpctn.org and get it there.
It was also in your email this morning.
Awesome. Any other community partners want to share? We have some extra time today.
We have a presenter.
Oh, we do. Okay.
Health Council update.
Yes, very quickly, I have back to school bash will be at the health department this year. And we have it scheduled for the 20th of July. If you want to set up a table, let me know. And then be on the lookout for an email, because I've got, at the last meeting, I requested to change the name because there are so many back to school bashes in the county. And there was confusion. Somebody donated to the wrong one, which is fine. But I wanted to have kind of our own entity since we've been doing it for so long. So be on the lookout for an email for you to vote on the name. I will be sending that out this week. But as of right now, the event is set up for July 20th. And we'll probably do early morning. I don't have the times yet, but we'll probably do like 9 to 12 or 8 to 11, that sort of time. So that it's not so hot during the day. But it will be drive-through. We'll make it drive-through.
Okay. All right. Well, let me introduce to you Mr. Justin Owen with Tennessee Voices SoCat. Take it away.
All right, thank you. Thank you, everybody, for your time today. Thank you for this opportunity to share SoCat with you. As some of you may can already see, Hope I'm not in the way here. We'll sit down if I am. My ugly face is not what's important anyway, so it's okay. SOCAT stands for System of Care Across Tennessee. We are under the umbrella of the Department of Mental Health and Substance Abuse Services. So what is a system of care? We are a philosophy in which we partner with families and youth. We see the families as the experts in their family dynamics and believe that they have valuable insight into what their family needs. We offer community-based services supports. We recognize that the only way these services and supports are going to be any good is if families can access them. We are a coordinated network because if y'all have ever done any researching, looking for resources to help your family and your needs, you'll know it's a huge task trying to call different agencies and work through different things like that. So what we try to do is sort of take the legwork out for the family and bring them services right to their doorstep. And we understand that their cultural and linguistic needs are individual and specific to every family. We sort of try to meet the families where they are, or sort of a tailor-made approach. You can think of it like that. So what does SOCAT do? Now, what you see before you is not a full list of what we do. You guys don't have time for that, and I don't have that much voice. But what this is a short list of what the family's perspective would be in their home when we come to help them. So we build teams of formal and natural supports around the family. We identify and utilize the strengths of each team member and develop and update plans of care with the teams at monthly CFTMs. And just in case anyone here doesn't know, CFTM stands for Child and Family Team Meeting. We develop and update crisis plans with the team monthly and assist the family in coordinating all services. It's much better to think of us as more of a partnership than a program, and the reason being is because it's exactly what we try to do. Come in the home, we build relationships with the family and assist them as their caregiver to their child or grandchild, whoever they're working with that mental health or behavioral need. So who does SOCAT serve? Our eligibility is any child, youth, or young adult between the ages of 0 and 21 who's experiencing emotional or behavioral concerns that affect their daily life. They could be at risk of psychiatric hospitalization, residential placement, or DCS custody, and could be at risk of being removed from school, preschool, childcare, or the home. And because we are that partnership and not a program, we do ask that they be a willing and interested participant in working with us. So what does SOCAT look like? Our teams are assigned according to the family's needs, going back to that tailor-made approach. We are built of either a care coordinator and a family support specialist, or a care coordinator and a therapist if that is needed. Our care coordinators are kind of like an air traffic control. They build a team around the family. They assist with the facilitating of the monthly CFTMs. They update and develop the crisis plans for the family, and just kind of there to ensure everything is working smoothly in the right direction as we work with the family. And of course, our family support specialist is my favorite of our team because they're someone with lived experience. They are someone that has navigated through child serving systems. They know all about it, and they've got that beacon of hope that they can be to the caregiver, to the parent, saying, hey, you're dealing with someone that has been through this. There's that level of empathy there. And it shows the caregiver, hey, success is possible for your child, grandchild, or whoever we're serving. And of course, the therapist, if need be, like I said. We cap our teams off at 12 families. We do this to make sure that our teams don't get overwhelmed. If you guys have talked with DCS very much, you'll know they are absolutely overwhelmed, and that's something we're trying our best not to do, but the need is great. But we do this because our plan is an extensive plan, and we partner with the families usually for up to a year. And so we want to make sure each team is capable, got the time on their hands needed to assist the family in their care. It's intensive, high fidelity wraparound with those weekly visits. We do a virtual if need be, and the monthly CFTMs that I discussed. Our goals are simple, to the point. We want to see a decrease in the utilization of inpatient care. We want to see a reduction of out-of-home placements, a decrease in the juvenile justice and child welfare involvement, see improvements in school performance and attendance, And most of all, we want to see improvement and sustainability in the child's mental health. In a nutshell, if it's safe to do so, we want to try to keep the child at home with mom and dad or their caregiver where they're most safe to be, that they can thrive the most at. Our outcomes, this is a little bit of data from 2017 to 2020, and that time we served over 330 families. Out of those 330 families, 88% of them did not go to the ER or was hospitalized due to a psychiatric need, and 93% of those families was not arrested nor went into custody. We're very proud of those numbers. That's why we share them, and we believe those numbers speak for themselves to say that SOCAT does make a difference in keeping children at home and keeping them safe. This map here that you see is a color coordinated map. I don't know if everybody can read the names there at the bottom, but by color coordination, in green's the McNabb Center, professional care services in yellow, and orange is pathways, light blue is volunteer behavioral health, the red up there in the East Tennessee corner is Frontier Health, the light green is Tennessee Voices, and the dark blue is Mental Health Co-op. The reason why I show you this map is for a couple things. Number one, you'll notice there is no county in Tennessee that is not colored, and some of them are striped because they're multicolored, meaning multiple agencies cover those counties. This means, biggest thing is that SOCAT covers all of Tennessee, all 95 counties. Not only that, but because we partner with these agencies, we are better able to prepare to serve our families. These agencies are known and trusted by many of you, and they're ingrained into their communities. So they already have a working knowledge of the culture, the background of that community, and the location of the resources in that community. And we partner with these agencies to better serve these families and give them better care. Don't you love the summer mowing season? Amen. I'm a pastor, that's why I said amen. Forgive me, that's a bad habit. Anyway, so our referrals, it's real simple. They're super easy and fast. Anybody can make a referral. You can make a referral for yourself, for someone that you know. You just go to the website there in blue at socacrosstn.org, and you'll see right there circled in red, your page will look just like that. Hit the make a referral button. When you do, you'll see a screen looks like this. Now you can download the form. If you've got the 1980s mentality, you can still download a paper form. For most people, it's going to be real simple to put the information right there online. It's real minimal information for if you're the one making the referral. All that we ask for, don't hold me to this, but I'm pretty sure I'm correct, is your name, email, phone number, agency you work with, and the name of the person that you are referring. And then for the referent, the person you're referring, they need their name, phone number, and the county that they reside in. Now, the only thing that we do ask is because we are a partnership, it's totally free to the families. So we're working with them. We ask that you sort of discuss with them what we do. So we're not just giving them a phone call and they're like, who are you? No, you're not taking my child from me, that kind of stuff, because we're still working through breaking through that stigma of being labeled as DCS, and you're here to take my child, and that's exactly opposite of what we want to do. We want to, if it's safe, we want to keep them at home with mom and dad or whoever, so they can grow and thrive there at home. So just kind of talk with them about it and share a little bit about it. That way they know what they're looking out for. They know this is a partnership. That being said, I'm pretty much done. I will do this presentation at the drop of a hat. I'll throw your hat in the minute that I can to do that presentation. I love doing these because I believe in what we do. I believe it can make a great impact in Tennessee and the families in Tennessee. And so if any of y'all would like an additional presentation or know some teams that can benefit from this, please reach out to me. We've got some SOCAT flyers. I handed out at least everyone at the table. I think we've got one extra for you on the side there. That's got all the referral information. It's info if you do want to make a referral. Kind of give you a little spiel there that you can tell people about what's going on when you want to refer them. And if anyone wants to talk with me directly, I can give you my contact info afterwards, and we can discuss going further. But that being said, you can also stay in the loop with us on Facebook, Twitter, and Instagram. You can also join us with us on the mailing list at socacrosstn.org. And And as you can see, no spam included. We only try to share relevant information. We will not be blogging you down with a bunch of spam and junk. I know I hate that too, so we try not to do that. That being said, that's got me done today. Is there any questions from anybody before I get out of y'all's hair?
Are you working with school system social workers?
We are, yes, ma'am. We're trying to partner with all school systems, DCS, truancy, all that. Matter of fact, I'm trying to get in as many truancy specialists as I can, get connections with them, because I know a lot of times that's kind of the first line of defense when we see stuff like this. So.
Do you have this in electronic form so I could?
I do. If you'll get with me, get my card afterwards, I can get your info. I can send these to you electronically.
Do you offer it to probation officers?
We do, yes. Our program is free, grant funded, so we can work with pretty much anybody. And thank you for the question. It reminds me, we don't require a mental health diagnosis. You can simply just be a suspicion of some kind of needs. Maybe the school's got a little something funky they're noticing, and they reach out to the parents, whatever it may be. We're pretty open window when it comes into referrals coming in. And then once that phone call is made, that's when we start kind of bleeding things off and finding out exactly what we need to do. But yes, we are open for just about anybody to make a referral. Thank you. Anyone else? All right. Thank you guys so much for your time.
Before we go over announcements, does anyone else have anything they want to holler over the lawnmowers?
I guess I can start. In your packets, we have included the one-day event flyer with the information. So feel free to post that at your local business or share the information.
There's also, excuse me, there's also Drug Take Back Day. That is the 30th. When we set up at Franklin County Farmers Market. If perchance you can't make it, remember all our local police departments have boxes where you can get rid of your expired or unused medicines. And then also on May 5th is Franklin County National Day of Prayer. The mayor's office sent this out, and they would like to invite everyone at 12 o'clock at the old football field in the annex.
Can they bring any medications?
Yes.
Like over-the-counter stuff?
Yes.
Okay.
Yes.
You don't have to take labels off, you don't have to mark anything, it goes right into an evidence barrel, it gets sealed, and then it gets thrown in.
Okay. Sorry, Sharon, I forgot you were sitting there. I took your thunder.
All right, also on the announcements and upcoming events, it says Isaiah 117 needs volunteers. Contact Johnson at 931-570-2002. Send an email to Susan at Isaiah117house.com or visit the organization's Facebook page. Also, hopefully, very soon you'll see an article in the newspaper that highlights our Zumba challenge, which is now complete. So we still do Zumba on Tuesday and Thursdays, but our boot camp is over. We had 3 people that.
You want to tell them how it went?
Yeah, it was great. I can't even remember. I mean, she'll tell in the newspaper who won and all that, but the winner, I think she lost 10% of her body weight in 12 weeks. Super proud.
It was in the newspaper this past week.
It was.
So it's pictures.
Gotcha.
Okay.
These girls missed it. Somehow. I didn't get the paper, so that's fine. So perfect. You can check it out in last week's newspaper. All right, anybody else? You still have 10 minutes.
Tuesday and Thursday, this is Monday and Thursday.
It changed.
It has changed. It was Monday and Thursday, but we went back to Tuesday.
And it's Tuesday at 5:30, Thursday at 6 p.m. at the Rain Teen Center.
all middle and high school kids are free.
Tuesday.
Dustin, you can help her take all of us. You need some cardio, I tell you, you can't just be pumping iron.
Oh, we have.
Quantities at our, steak cook-off and barbecue cook-off, we're gonna have vendors, so nonprofits are free if anybody wants to sit up, just let me know.
What day is it?
The 14th is the big vendor thing, but the 21st, the carnival and stuff will be there, so there'll be lots of kids.
All right. If you haven't done the survey, there's paper ones there, or there's the QR code. You can come up here and scan it. There's your
Please
opportunity.
take it before you leave or you'll forget.
It only takes like 3 minutes to complete.
Can we give that to the kids at the range or let the young?
They're too young.
We can send it over to parents.
We could.
They did? Okay, so they did decide that high school students can take. Okay.
Okay.
Take some from high school. Okay.
All right. Well, if anybody, if no one has any other questions or comments, do I have to make a motion to adjourn? I'll take a motion to adjourn, or y'all are not leaving here.
So be it.
Miss Pat made a motion to adjourn. Does anybody want a second? Dustin seconded. All
Thank
right.
you, everybody, for being with us today.
Next meeting is May 16th.